cognitive changes, a confirmed PA1 genetic mutation associated with increased thromophilia-related reproductive risk. However, beyond laboratory findings, her emotional story was profound. She was experiencing the long-standing marital stress, caring for a child, her early gestation with a child born with autism, living under persistent anxiety about conceiving again, emotionally drained due to multiple medical consultations. When she came to me, her greatest complaint was not just infertility. It was the fear how the outcome of the pregnancy will be without any thrombophilia risk, or whether the second child also will be autistic, because she have chosen the early gestation with the outcome of elective cesarean section along with use of fragmentin and heparin. She has the great fear of miscarriage, fear of complications, fear of genetic risk, and fear of medical failure. She was based on Poland. She is a citizen of Poland. Clinically, she presented with severe emotional instability, frequent anxiety episodes, poor sleep, chronic fatigue. Almost reduced vitality to take care of her first child with autism without any family support. Irregular menstrual cycles, that too profuse dysmenorrhea, which could be intermediate once in a month or twice a month or 15 days once or 10 days once, that too prolonged bleeding for 10 days with large clots. So she had a fear of pregnancy complications. During her early gestation assessment, her amniotic fluid index measured 28, which raised additional concerns for her for the second gestation. Despite everything, she expressed a strong preference for a natural, supportive and holistic approach. I reviewed all the investigations carefully with the gynecological support every month and every 15 days once, monitoring her genetic mutation and amniotic fluid index. In fact, she took every month ultrasound as she was staying in Poland. Rather than treating the reports in isolation, I correlated the objective findings, subjective complaints, emotional dysfunction, constitutional tendencies. Homeopathy requires the individualized totality. From a homeopathic perspective, this was not merely a hormonal disorder. It represented a layout of psychosomatic state maintained with deep insecurity, fear about the future, anxiety for health, emotional exhaustion in taking care of her own autistic child, mental overstrain, without support from her own family members. Her emotional imbalance was not isolated along with endocrine. It was influenced by prolonged emotional stress. My goal was to stabilize the emotional sphere and improve the adaptive capacity, supporting her endocrine function gently, strengthen the vital force. My treatment plan with the individualized constitutional approach was adapted with the previous pregnancy history with stress factors and genetic history of PA1 mutation and personal conflict with emotional stress due to marital conflict and caregiver stress. First, considering the anxiety about health and future. fear-driven anticipation, hormonal dysfunction, emotional insecurity, dependency in taking care of her own child. She always narrated one thing: how I can handle my autistic child without support of anyone. She forgot that her own responsibility as a mother to accept her autistic child as well as to take care of her autistic child. So, considering these things, I prescribe her Calcarea arsenicosa 30 ch with the consideration of insecurity, anticipation towards health and future, fear-driven anticipation and dependency, forgetting the own mother responsibility. In between, as a supporting perspectives, I included Andika 5 ch because she was noted down with amniotic fluid index increased around 5th month, around 21. So, considering her vitality and considering regarding, because she was not ready to take conventional drugs. So, considering this, I prescribed her Andika 5 ch with a repeated dosage from water every week for 2 months. After giving Andika 5 ch, the 3rd month her result was beautifully, the amniotic fluid came to 70, which is very normal index. Here, I would like to emphasize this was done alongside appropriate medical supervision, continuous gynecological observations and continuous investigations taken. Homeopathy was practiced responsibly, not as an alternative to emergency care, but as a complementary constitutional support. I observed with emotional improvement, reduced anxiety, better sleep, enhanced coping capacity, menstrual cycles regularized, reduction in thyroid-related complaints. Her fear reduced, her emotional confidence improved. The natural conception happened after started with Calcarea 30 ch and in between the interval of 4th month, I repeated Calcarea arsenicosa 200 ch. The clinical significance I want to mark here is the emotional healing is central to reproductive health. Individualized constitutional prescribing is powerful when practiced responsibly. Homeopathy can serve as a complementary system in complex reproductive challenges. It is not about replacing outcome. It is not about replacing conventional medicine. It is about integrating wisely and ethically. She delivered the child, beautiful child of using Calophyllum 5 ch prescribed on the day of the labor. She took it as a repeated dose in water through adding single pill in 100 ml of warm water every sip 1 hour once. She delivered a beautiful baby of Apgar score 10 after 10 with 3.9 kg normal delivery birth. Her gynecologist enlightened that you have delivered your child like a lightning. I want to acknowledge the patient for her trust, my mentors and colleagues, my family for unwavering support. Who I am today is because of my family as well as my mentor. And final thank to the Ministry of Ayush for promoting traditional system of medicines among global platforms. Thank you.
Okay, thank you so much, Dr. Bhuvaneshwari. That was a very impressive presentation. Moving on to our next